So today we will discuss about the carotid artery and its collateral branches in the cattle. So आज हम carotid artery and इसकी जो collateral branches है उनके बारे में हम discuss करेंगे. So first, as we know, the common carotid artery, both right and the left common carotid artery, they arise from the bicarotid trunk. So these common carotid artery then they pass obliquely up the side of the neck and they get, so when they ascend they get diverge. So each carotid artery crosses the trachea obliquely. So initially the carotid artery remains below the trachea, then it comes at its side, and then finally from the middle of the neck the carotid artery it runs over the dorsal face of the trachea. So in this chorus, it is related with internal jugular vein medially, vagosympathetic trunk dorsally, and recurrent laryngeal nerve ventrally. So each carotid artery, when it reaches to the point of termination, it gets deeply placed. That means here the carotid artery, it is related laterally with the parotid and mandibular gland, and medially it is related with the esophagus. And there is a difference between the right and the left common carotid arteries. The difference is that the left common carotid artery, it is deeply related with the esophagus. That means the esophagus separates the left carotid artery from the trachea in its course, while as the right carotid artery, it is not related with the esophagus. So each carotid artery, when reaches to the point of termination, that means at the level of the digastricus, each carotid artery terminates in a trifurcation by dividing into three arteries: occipital artery, external maxillary artery, and external carotid artery. So each carotid artery, when it reaches to at the level of the digastricus, it gets terminated in a trifurcation. That means three arteries arises from each carotid artery. One is occipital, external maxillary artery or facial artery, and external carotid artery. So, but when there is bifurcation of the common carotid artery, there is origin of occipital artery and external carotid artery, while as the external maxillary artery जो होती है, it arises from external, then it arises from the external carotid artery. Now coming to the collateral branches of the carotid artery. The carotid artery, it gives branches to trachea, esophagus. It gives anterior thyroid artery and thyrolaryngeal artery. The thyrolaryngeal artery, it is the largest collateral branch of the carotid artery, and it divides into thyroid branch and the laryngeal branch. The thyroid branch, it enters through the anterior extremity of the lateral lobe of the thyroid gland, while as the laryngeal branch, it supplies to the muscles of the pharynx and the muscles of the larynx. Now the next collateral branch is the posterior thyroid artery. Posterior thyroid artery, when present, it enters through the posterior extremity of the lateral lobe of the thyroid gland. Next collateral branch is the parotid artery. The parotid artery, it arises from the common carotid artery and it supplies to the parotid salivary gland. Muscular branches, the muscular branches, they supply to the ventral muscles of the neck. Now coming to the next collateral branch, this is the posterior meningeal artery. Normally posterior meningeal artery, it is the collateral branch of the occipital artery. But it has been found in some subjects that it is given off from the common carotid artery. So this posterior meningeal artery, then it becomes the last collateral branch of the carotid artery. So this posterior meningeal artery, it enters into the cranial cavity via the foramen lacerum and help us in the formation of the RMC, rete mirabile cerebral. So these were the different collateral branches of the carotid artery. Now coming to the, so here in the diagram you can see this is the common carotid artery. The common carotid artery head here it gives, this is the external maxillary artery or facial artery, it arises from the here, and this is the occipital artery, and this is the continuation of the common carotid artery that is known as external carotid artery. So this is the trifurcation of the common carotid artery at the level of the digastricus. Now the first terminal branch of the common carotid artery, that is the occipital artery. So the occipital artery, it is very small in case of the ox, and it is the smallest terminal branch of the common carotid artery. This occipital artery, it passes upwards and forwards under the wing of the atlas, and during its course it gives the following branches. So the occipital artery, it passes upwards, forwards under the wing of the atlas, and during its course it gives these following branches. First is the muscular branch. They supply to the muscles of the head. Next branch is the pharyngeal branch. The pharyngeal branch, it is inconstant. So that means pharyngeal branch, it is sometimes present or sometimes absent. So when it is present, it is divided into the pharyngeal branch and the palatine branches. So the pharyngeal branch, obviously it supplies to the pharynx, while as the palatine branch, they supply to the soft palate. But when the pharyngeal branch is absent, then it is, अब क्या होता है, it is represented by one of the branches of the external carotid artery. And now the next collateral branch of the occipital is the very important, that is the posterior meningeal artery. So it is a small branch that arises from the occipital artery through the foramen lacerum. It enters into the cranial cavity and contributes in the formation of rete mirabile cerebral. So when the occipital artery runs under the wing of the atlas, then it continues as in condyloid artery. So the condyloid artery then enters through the condyloid foramen, इसके साथ in company with the hypoglossal nerve, that is the 12th cranial nerve. So condyloid artery कहाँ से पास होती है? Condyloid foramen in company with the hypoglossal nerve. Then this condyloid artery joins with the vertebral branch and form the rete mirabile cerebral. So these were the different collateral branches of the occipital artery. So occipital artery, it is the smallest terminal branch, and it is continued as the condyloid artery, which finally contributes in the formation of RMC. So here you can see from here, this is the occipital artery. From here you can see this is the occipital artery. Finally it continues as a condyloid artery through the condyloid foramen. It enter into the cranial cavity and contributes in the formation of the RMC. And here this you can see, this is facial artery or external maxillary artery or linguofacial artery, and this is the external carotid artery, continuation of the common carotid artery. Now the second branch is the external maxillary artery or facial artery. It's also known as linguofacial artery. So it is one of the terminal branches of the common carotid artery, which arises by trifurcation. As we have already discussed, when there is trifurcation, then the external maxillary artery arises from the common carotid artery. But when the carotid artery bifurcates, then the external maxillary artery arises from the external carotid artery as a collateral branch. Okay, so this external maxillary artery or facial artery, it goes downwards and forwards on the lateral wall of the pharynx, which is accompanied with the hypoglossal nerve. Then it reaches to the ramus of the mandible, and after reaching to the ramus of the mandibles, it turns around the posterior border of the horizontal ramus of the mandible in company with external maxillary vein or facial vein plus Tension's duct and ventral buccal nerve. So the external maxillary vein, it turns around the posterior border of the horizontal ramus, which is accompanied with the facial vein, the Tension's duct and the ventral buccal nerve. Here it is placed subcutaneously. So when it is placed subcutaneously, it can be used for feeling the pulse. Then this external maxillary artery, it ascends the cheek की तरफ जाएगी in front of the masseter muscle and under the zygomaticus. Masseter के आगे चलेगी, then passes under the zygomaticus and finally it terminates at the nostrils. Now, there are some collateral branches of the external maxillary artery. Now, first is the pharyngopalatine branch. The pharyngopalatine branch, it divides into pharyngeal and palatine. The pharyngeal branch supplies to the pharynx and the palatine supplies to the soft palate. Next is the parotid branch. The parotid branches, they supply to the parotid salivary gland. So these are the collateral branches of external. Very important now, the collateral branch is the lingual artery. So the lingual artery, you remember that it is as large as the parent artery. That means it is as large as the external maxillary artery. And this lingual artery, it supplies to the muscles of the tongue and mandibular salivary gland. Here, this lingual artery, it gives off a branch that is known as sublingual artery. This sublingual artery, it supplies to the sublingual salivary gland. So first was the pharyngopalatine branch, second was the parotid branch, and the third was the lingual artery. Very important artery which gives of a branch that is known as sublingual branch, which supplies to the sublingual salivary gland. Now coming to the next is the inferior labial artery. The inferior labial artery, it arises from the external maxillary artery when it turns around the horizontal ramus. So at the point when the external maxillary artery turns around the horizontal ramus, the inferior labial artery arises at that point. This inferior labial artery supplies to the buccinator muscle, supplies to the lower lips and skin. The next collateral branch is the superior labial artery. The superior labial artery, it is the continuation of external maxillary artery. This superior labial artery, it supplies or it gives branches to the masseter muscle, zygomaticus, malaris and upper lip, and finally terminates at the nostrils. So these were some collateral branches of the external maxillary artery. Now here in the diagram you can see this is the common carotid, this is the external maxillary artery. External maxillary artery runs from here when it reaches to the ramus of the mandible. Then here it turns this, here it turns around the posterior border of the horizontal ramus, and from here it then ascends in front of the masseter muscles and then under the zygomaticus and finally terminates at the nostrils. So it gives here, this is the lingual artery and this is the sublingual artery. So sublingual artery arises from the lingual artery which supplies to the sublingual salivary gland, and this is the lingual artery which supplies to the muscles of the tongue. This artery is the inferior labial artery which supplies to the lower lips and the skin. And this is the superior labial artery which supplies to the masseter, zygomaticus, malaris and upper lips. Now, next is the external carotid artery. It is generally considered as the continuation of the common carotid artery. The external carotid artery, it passes forwards and slightly upwards and terminate below the level of the temporomandibular. So external carotid artery कहाँ पे terminate होती है? Just below the level of the temporomandibular articulation. किसमें? सुपरफिशियल टेम्पोरल एंड इंटरनल मैक्सिलरी आर्टरी. एक छोटी सी ब्रांच होती है जिसको हम सुपरफिशियल टेम्पोरल आर्टरी बोलते हैं एंड द मेन कंटिन्यूएशन इज द इंटरनल मैक्सिलरी आर्टरी. Now coming to the collateral branches of the external carotid artery. So external carotid artery से कौन-कौन से branches arise होती है? Pharyngeal branches that goes to the pharynx, then branches to the parotid salivary gland, then the branches to the mandibular salivary gland. Next is very important, the posterior auricular artery. Posterior auricular artery, it arises from the external carotid artery and it supplies to the muscles of the external ear. It gives off a branch that is known as stylomastoid branch, which passes through the stylomastoid foramen and then finally supplies to the middle ear and the tympanic membrane. So पहले थी pharyngeal branch जो pharynx को जाती है, फिर parotid salivary glands को भी जाती है, कुछ branches mandibular salivary glands को भी जाती है, and posterior auricular artery जो that supplies to the muscles of the external ear. This artery, posterior auricular artery, it gives off a branch that is known as stylomastoid branch, which passes through the stylomastoid foramen and it supplies to the middle ear and the tympanic membrane. Then next is the muscular branches. The muscular branch, they also arise from the external carotid artery. They supply to the temporalis muscle, supply to the masseter, medial pterygoid muscles. So these muscular supply to the different types of the muscles. Now coming to the first branch, that is the superficial temporal artery of the external carotid artery. So this is the smallest of the two temporal branches. That means among the superficial temporal and the internal maxillary, the superficial temporal जो होती है वो छोटी होती है. ये क्या करेगी? It passes upwards under the parotid salivary gland, parotid salivary gland के नीचे से, then it goes upwards behind the temporomandibular articulation, and it emerges from the then parotid salivary glands in company with the satellite vein and auriculopalpebral nerve. Finally, it reaches to the base of the horn as a corneal artery. ठीक है, तो सुपरफिशियल टेम्पोरल आर्टरी फाइनली कहाँ पे, जो हॉर्न का जो बेस होता है वहां तक जाती है एज अ कॉर्नियल आर्टरी. हियर ये क्या, इसको क्या हो जाता है यहाँ पे, at the base of it is divided into anterior and the posterior branches. These supply to the corium of the horn, they supply to the frontalis muscle, they supply to the parieto-auricularis externus muscles. Now the collateral branches of the superficial temporal artery. Superficial temporal artery से कौन-कौन से collateral branches arise होती है? First is the anterior auricular artery. Anterior auricular artery जो होती है, it supplies to the muscles of the external ear, temporalis and skin. Transverse facial artery, it supplies to the masseter muscle. So this transverse facial artery, it passes in front of the masseter muscles and finally it supplies to these muscles. Then palpebral branch, which supply to the eyelids. Lacrimal branch, they supply to the lacrimal glands. Muscular branch, they supply to the temporalis and the frontalis muscles. And last is the cutaneous branch, they supply to the skin. So these were different collateral branches of superficial temporal artery. कौन-कौन सी होती है? Anterior auricular, transverse facial, palpebral branches, lacrimal branches, muscular branches and cutaneous branches. So उसके बाद आएगा, next is the main artery, that is the internal maxillary, which is the continuation of the external carotid artery. So it is larger among the two. छोटी कौन सी होती है? Superficial temporal, and जो बड़ी होती है that is internal maxillary artery. दिस इंटरनल मैक्सिलरी आर्टरी ये क्या करती है, इट passes obliquely forwards and upwards on the lateral aspect of the pharynx. Then it reaches to the lower part of the temporal fossa. वहां से क्या करेगी, it runs in company with the maxillary nerve along the pterygopalatine fossa to the finally कहाँ पे, maxillary hiatus तक internal maxillary artery पहुंचती है। ये maxillary hiatus में क्या होता है, यहाँ पे बहुत सारे foramens होते हैं, posterior palatine होता है, superior palatine होता है and maxillary foramen होता है, they are present in the maxillary hiatus. So at the maxillary hiatus it terminates, कौन सा, internal maxillary artery terminates into the malar artery, infraorbital artery, suprapalatine and palatine, जिसको हम greater palatine artery भी बोलते हैं, greater palatine artery इसको बोलते हैं. So these were the different terminal branches of the internal maxillary, कहाँ पे, maxillary hiatus पे. Now coming to the different collateral branches of the internal maxillary artery, उसमें सबसे पहले क्या आएगी, pterygoid branches आएंगी. The pterygoid branches क्या है, they supply to the pterygoid muscles. दूसरा आएगा parotidotemporal branch. The parotidotemporal branch it divides in the parotidoauricular. Parotidoauricular further divides into the parotid branch which supply to the parotid gland, and the auricular branch that passes through the foramen of the conchal cartilage and supplies the skin. So parotidoauricular branch generally supplies to the parotid gland and the skin of the external ear, that is through auricular branch. Now another branch of this parotidotemporal branch is temporomeningeal branch. This temporomeningeal branch it passes through the temporal canal, and it within the temporal canal it gives a meningeal branch. It detaches a meningeal branch which supplies to the durameter. And then क्या होता है कि this temporomeningeal branch जो होती है then comes out of the temporal canal and it is distributed to the temporalis muscle. So temporomeningeal branch is supplied to the temporalis muscle and the durameter. That means the meningeal branch which arises within the temporal canal, it is supplied to the durameter, and then this branch comes out of the temporal canal, it finally supplies to the temporalis muscle. So ये पहली थी pterygoid branches, second was the parotidotemporal branch, third is the mandibulo-alveolar branch जिसको हम inferior artery भी बोलते हैं या alveolar artery, या इसको that is main is the mandibulo-alveolar artery. So it is कहाँ से arise होती है, it is the collateral branch of the internal maxillary artery. So it arises from the anterior face of the internal maxillary artery. It passes downwards, forwards over the medial pterygoid muscle on the medial face of the vertical ramus of the mandible. So downwards हो जाती है, forwards हो जाती है, and finally जो medial surface of the vertical ramus of the mandible वहाँ पहुँचती है. जैसे mandible होता है उसमें vertical ramus होता है, horizontal ramus होता है. So medial face of the vertical ramus तक ये पहुंचती है. Then here it enters through a foramen that is known as mandibular foramen. It is present on the medial aspect of the vertical ramus. So it enters through the mandibular foramen. Then फिर क्या होता है, then passes downwards and forwards किसमें, in the mandibular canal. So foramen यहाँ पे होगा, then फिर वहां से canal बनता है that is known as mandibular canal. फिर उसी mandibular canal से pass होके it finally किसके साथ, accompanied with the mandibular nerve, that is a branch of the trigeminal nerve and vein, and terminates at the mental foramen. ठीक है, तो जाती है ये mandibular foramen से through mandibular canal and terminates at the mental foramen. So mental foramen पे terminate होती है किसमें, दो arteries में. So one is the mental branch and another is the incisor branch. ये मेंटल ब्रांच क्या करेगी, द मेंटल ब्रांच जो होती है इट इमर्जेस, ये बाहर निकलती है, इमर्जेस थ्रू द मेंटल फोरामेन एंड एनास्टोमोसिस in the lower lip with the mental artery of the opposite side and the inferior labial artery. Inferior labial artery this is the collateral branch of the external maxillary artery. So the mental branch क्या होता है, ये mental foramen से बाहर निकलती है, lower lip को supply करती है, inferior labial artery के anastomos and the mental artery of the opposite side. Now the next branch is the incisor branch. जो incisor branch होता है, it continues forwards in the bone between the roots of the incisors and its branches are distributed to them. So the incisor branch जो होता है, it gives branches to the roots of the incisors, while as the mental branch it supplies to the lower lip when it comes out through the mental foramen. Now ये जो mandibular alveolar artery जो होती है, during the course it gives branches to the pterygoid muscle and mylohyoid muscle and within the mandibular canal जहाँ से pass होती है along with the mandibular nerve and vein क्या करेगी, it gives dental branches. The dental branches जो होते हैं, they supplies to the lower cheek teeth. So within the mandibular canal, mandibular alveolar gives dental branches which supplies to the lower cheek teeth. Next one is the middle meningeal artery. So middle meningeal artery, it arises from the posterior face of the internal maxillary artery. This middle meningeal artery, it passes through the foramen ovale and enter into the cranial cavity and help us in the formation of RMC, rete mirabile cerebral. So this from this foramen ovale there is one nerve also present that is known as mandibular nerve. So this middle meningeal artery, it is accompanied with the mandibular nerve and they pass through the foramen ovale. So when the middle meningeal artery enter into the cranial cavity, it helps us in the formation of the RMC, rete mirabile cerebral. Next branch of the internal maxillary artery, the anterior deep temporal artery. So this anterior deep temporal artery arises just above the middle meningeal artery and it supplies to the temporalis muscle. Now the buccal artery, it supplies to the pterygoid muscle, it supplies to the masseter muscle, it supplies to the buccinator muscle. Next collateral branch is the anterior meningeal artery. Anterior meningeal artery जो होती है, these are 2 or 3 in number, and anterior meningeal artery क्या होते हैं, they go upwards and forwards along with the maxillary nerve and enter into the cranial cavity through the foramen orbitorotundum. So foramen orbitorotundum से enter करती है into the cranial cavity and they also play very important role in the formation of the RMC. So middle meningeal artery foramen ovale से जाती है and anterior meningeal artery through foramen orbitorotundum से they enter into the cranial cavity. Now coming to the very important artery, that is the ophthalmic artery. The ophthalmic artery, it arises from the internal maxillary artery. As we know, this artery when it after its origin it goes vertically upwards. फिर क्या करेगी, it penetrates the orbit जहाँ पे eye होती है, that's known as orbit, उस orbit को penetrate करता है and passes under the superior rectus muscle of the eye and form a vascular network जिसको हम बोलते हैं rete mirabile orbital or ophthalmic rete mirabile. So a vascular network is formed by the ophthalmic artery under the superior rectus muscle of the eye within the orbit. So then the artery, then it goes forwards and reaches to the medial rectus muscle and divides into supraorbital and ethmoidal artery. So supraorbital and ethmoidal artery फिर divide होती है. Now coming to the collateral branches of the ophthalmic artery से कौन कौन सी collateral branch arise होती है. So lacrimal branches होती है which supply to the lacrimal gland. Muscular branch they supply to the muscles of the eye. Then the conjunctival branch they supply to the conjunctiva. Then ciliary artery supplies to the ciliary muscle, ciliary body, and iris. And finally, the central artery of the retina which goes to the retina. So these were some collateral branches which arise from the ophthalmic artery. So now coming to the main topic, that is the ophthalmic artery divides into the supraorbital, that's also known as the frontal artery, and the ethmoidal artery or nasal artery. Supraorbital artery, it passes through the supraorbital foramen and then gains the enter into the frontal sinus and supplies to the mucous membrane of the frontal sinus. While as the ethmoidal artery or the nasal artery, it enters into the cranial cavity through ethmoidal foramen and then it traverses the cribriform palate of the ethmoidal bone inwards and forwards along a groove near the crista galli. तो क्या करती है यहाँ पे, it gives off a meningeal branch which goes to the fox cerebri. Fox cerebri क्या होता है? It is actually a fold of dura mater, a sickle shaped fold of dura mater. So this meningeal branch goes to the fox cerebri. Then the ethmoidal artery leaves the cranial cavity and enters through into the nasal cavity via a foramen. So cranial cavity से निकल के nasal cavity में ये जाती है and it supplies to the mucous membrane, nasal mucous membrane, but the posterior part. So supplies to the posterior part of the nasal mucous membrane. So ethmoidal foramen से enter करेगी into the cranial cavity, where it gives a meningeal branch which goes to the fox cerebri, and then from the cranial cavity it goes into the nasal cavity through a foramen and supplies to the nasal mucous membrane. Now coming to the finally to the terminal branches of the internal maxillary artery. So कौन सी terminal branch है? First is the malar artery. The malar artery क्या करती है? It exits out of the orbit and gives branches to the lower eyelid and malaris. So malar artery supplies to the lower eyelid and malaris. Then it divides into ascending branch and descending branch. The ascending branch supplies to the upper eyelid and frontalis muscle and it anastomoses with the superficial temporal artery. While as the descending branch is the known as dorsal nasal artery and it supplies to the nasal muscles and the nostrils. So this is the first terminal branch of internal, that is malar artery, जो lower eyelids and malaris को जाती है. Then it divides ascending and descending. Ascending upper eyelids and frontalis को जाएगी. Finally anastomosis with the ST, superficial temporal artery. Descending branch of the malar artery is known as dorsal nasal artery, जो nostrils and nasal muscles को supply करती है. Now coming to the next, that is the infraorbital artery या superior dental artery भी हम इसको बोलते हैं. ये कैसे? It arises with the malar artery and it enters through the maxillary foramen. ये कहाँ पे होता है? In the maxillary hiatus. वहाँ से पास होके then through the infraorbital canal and exits out at the infraorbital foramen. So ये जाती है maxillary foramen से via the infraorbital canal, reaches to the infraorbital foramen से बाहर निकलती है and then continues as a lateral nasal artery. So this infraorbital artery, it supplies to the nostrils. Within the infraorbital canal it gives dental branches. जैसे मैंडिब्यूलर कैनाल में डेंटल ब्रांचेस देती थी, mandibular alveolar artery, same here within the infraorbital canal the infraorbital artery gives dental branches. It supplies to the upper cheek teeth. Now coming to the suphenopalatine artery. Suphenopalatine artery arises with the greater palatine artery and it passes through the suphenopalatine foramen of the maxillary hiatus into the nasal cavity. and it gives branches to the nasal mucous membrane, palatine sinus, maxillary sinus, etc. So this was the third terminal. First was the malar artery, second was the infraorbital artery, third was the sphenopalatine, and the last is the greater palatine artery. The greater palatine artery, so what's its course? The greater palatine artery, it enters the palatine canal through a foramen, that is the posterior palatine foramen of the maxillary hiatus. Then it comes out at the anterior palatine foramen. When it comes out from the anterior palatal foramen, this artery passes forwards in a groove known as palatine groove of the heart palate. And finally, it enters into the nasal cavity through incisive fissure. So incisive fissure के through कहाँ जाएगी into the nasal cavity, and it terminates into the mucous membrane of the nasal cavity. So it supplies to the anterior part of the nasal mucous membrane, and during its course यह करेगी, it also gives branches to the soft palate, hard palate, and dental pad. This was all about the greater palatine. So greater palatine and the palatine canal, posterior palatine foramen से enters, then runs through the palatine canal and finally leaves at the anterior palatine foramen. वहाँ से it passes through a groove that is present in the heart palate known as palatine groove and finally terminates into the nasal cavity. वो कहाँ से pass होती है? Through the incisive fissure. So it's supplied to the mucous membrane of the anterior part of the nasal cavity. ठीक है. So here in the diagram you can see this is the common carotid artery. Common carotid artery, here it will bifurcates this into the occipital artery. This is the occipital artery. The occipital artery that will run under the wing of the atlas, and finally it will continue as a condyloid artery. Then through the condyloid foramen it contributes in the formation of RMC. And the another branch is the external carotid artery. This is the external carotid artery. From the external carotid artery, the external maxillary, this is the external maxillary or the facial artery. So here it arises from the external carotid artery because there is bifurcation. This is the facial artery or external maxillary artery. This is, it gives a lingual artery which supplies to the muscles of the tongue. And here this external maxillary artery or facial artery turns here, then continues. This is the superior labial artery, and here this is inferior labial artery. This is the main continuation that is known as external carotid artery. At just below the temporomandibular articulation, it divides into the superficial temporal artery here, and this is the main continuation, that is the internal maxillary artery. This is internal maxillary artery. Here it gives different collateral branches, and finally it terminates into, this is the palatine, greater palatine artery. This is the malar artery, and here this is the infraorbital artery. So the infraorbital artery via the infraorbital canal, then it exits out at the infraorbital foramen here. So these are the dental branches of the infraorbital artery. This is the malar artery. It divides into, this is the ascending branch which supplies to the upper eyelid. This is the descending branch. This is the nasal artery which supplies to the nostrils and the muscles of the nostrils. So these are the different branches of the common carotid artery. Now at the end, answer these two questions. डैश आर्टरी एंड द डैश नर्व पासेस थ्रू द फोरामेन ओवल से कौन सी आर्टरी और कौन सी नर्व पास होती है? राइट डाउन योर आंसर इन द कमेंट सेक्शन. एंड द सेकंड क्वेश्चन इज जो रेटी मेराबार ऑर्बिटल है, इट इज फॉर्मड बाय होम एंड वायर, कौन सी आर्टरी बनाती है और कहाँ पे रेटी मेराबार ऑर्बिटल बनता है? तो अपना कॉमेंट राइट द आंसर इन द कमेंट सेक्शन। थैंक यू।